We're giving the participants a few seconds to come into the room. And as you do so, you could use the chat to introduce yourselves, please. Please place your identifiers in the chat, who you are and which country you are joining from. And as you do so, I'd like to welcome participants to this webinar on the topic, Accelerating Anemia Reduction in the Americas. And this is organized by the Pan American Health Organization, PAHO. I am Audrey Morris. I am the advisor on food and nutrition, regional advisor for PAHO, and I will be guiding you through this session. The session will be held in English and Spanish with simultaneous translation. Translation is available by clicking on the globe icon at the bottom of your screen. For some of you, you may have to click on the More button to find that globe that I mentioned. So you can click on that to get the translation. And as we progress through the webinar, I'm going to ask that any questions that you may have, for now, you may place them in the Q&A box, not the chat box, but the Q&A box. So once again, welcome to this webinar on Accelerating Anemia Reduction in the Americas. And I will ask Dr. Vanessa Garcia Larson, the Chief of the Risk Factors and Nutrition Unit in the Pan American Health Organization, to give her welcoming remarks. Over to you, Vanessa.
Thank you, Audrey, and hello, everyone. Welcome to this webinar on accelerating anemia reduction in the Americas. As we all know, anemia remains a significant global public health challenge, affecting approximately 40% of children before the age of 5 and 31% of women in reproductive age, that is 15 to 49 years of age. In the region of the Americas, an estimated 16.5% of children aged 6 to 59 months have anemia. Since 2000, many low and lower income countries in the region have achieved significant reductions, while progress has stagnated in some upper middle income countries. Among women of reproductive age, anemia prevalence declined until about a decade ago, but has since plateaued, with 21% affected in 2023. And this figure places the region at risk of not achieving the global nutrition target for anemia reduction. Anemia contributes to fatigue, reduced physical activity and work capacity, and during pregnancy, it increases the risk of complications such as placenta abruption, postpartum hemorrhage, and prenatal depression. Infants born to anemic mothers are also more likely to be preterm, have low birth weight, and to experience impaired cognitive development due to reduced iron stores. Additionally, anemia undermines health and well-being, as well as economic productivity. Addressing this public health problem is essential to achieving the World Health Assembly Global Nutrition Targets and Sustainable Development Goals. Increased attention and coordinated action are needed to accelerate progress. To guide countries, the World Health Organization developed the Accelerating Anemia Reduction, a comprehensive framework for action, also known in simple terms as the Comprehensive Framework, which consolidates recommendations on prevention, diagnosis, and management of anemia caused by micronutrient deficiencies, infections, obstetric and gynecological disorders, as well as inherited red blood disorders. This framework also emphasizes addressing social determinants of health and fostering multidisciplinary collaboration. And in alignment with this initiative, the Pan American Health Organization has developed a roadmap to address malnutrition in all its forms, including micronutrient deficiencies through a food systems approach. To support member states and their partners in making evidence-informed decisions, the WHO has issued the guidelines on hemoglobin cutoffs to define anemia in individuals and populations. Additionally, the WHO is also developing an implementation guide to support program managers in the implementation of the comprehensive framework across 5 key action areas, as well as a complementary monitoring guide to support performance management and progress tracking, providing a consolidating set of priority indicators and tools for data collection and organization. Today's webinar will further describe the situation of anemia in the Americas and also introduce different tools to support countries in the acceleration of anemia reduction. I do hope that this webinar will also serve as an opportunity for countries to share their experiences and insights. We welcome you all and look forward to a productive meeting and exchange of ideas on the challenges, priorities, and opportunities for collaboration between countries in the Americas. Thank you.
Thank you so very much, Dr. Garcia Larson. And I would want to review the objectives of today's webinar. Today, we're going to present the regional situation of anemia and its implications. We will introduce WHO's comprehensive framework for action and related tools for anemia detection and prevention. And thirdly, this webinar is meant to facilitate discussion on regional challenges, priorities, and opportunities for collaboration. Our first speaker this morning is going to be Leon Nederveen, and he is PAHO's advisor on food, nutrition, and physical activity in schools. As we welcome him, I would like to remind you that we have simultaneous translation in English and Spanish available by clicking the globe button at the bottom of your screen. Thank you, and over to you, Leo.
Thank you, Audrey. Good morning, everyone. Buenos días con todos y todas. Let me
Good
share
morning,
my screen.
everyone.
No, just a second. Okay, I hope you can all see my presentation now.
Yes, we can.
Okay, thank you very much.
You just need to put it in presentation mode.
Yes, it's now in presentation mode. So as you can see,
Sorry, we're not seeing that yet, though.
you don't see my presentation yet?
We see the presentation, but it's not in presentation mode.
Okay, that's is it okay now?
Yes. Oops, no, you it
It's not okay.
it was, and then you made a switch.
Is it okay now?
Okay, someone says perfect, so it may be me.
No,
Yes.
we don't see your the full screen. We see the presentation with the comments.
Okay. So I don't know how to remove those
You
comments.
had it a minute ago.
Okay. So now it's okay.
Not for me.
And for the rest?
Now is okay, Leo.
Okay, good.
Maybe
Okay.
just go back one slide.
Yeah, this is the first one. So
Perfect.
okay. So just to remind ourselves that we have a global target from the World Health Assembly of 2012. Actually, there are 6 global nutrition targets, and one of those is related to anemia. and the target is a 50% reduction of anemia in women of reproductive age to be reached by 2025. We are in 2025 now. And this target is part of the comprehensive implementation plan on maternal, infant, and young child nutrition. So that's important to remind ourselves, and also that anemia in reproductive age is like a proxy indicator for anemia in all population groups. Then, as well, in the agenda for sustainable development, we also have an indicator related to anemia, which is part of the Zero Hunger social sustainable development goal. The consequences of anemia, also just to remind ourselves, it's health related, increased risk of infection and death, increased risk of miscarriages, stillbirth, prematurity, and low birth weight, and extreme fatigue and lethargy. But it's also developmental. There's lower cognition in children and poorer growth and development, which in the end also has wider consequences for the community and for the economic growth of countries, because it implies an impaired physical productivity and work performance and loss of earnings. When we look at the prevalence of anemia worldwide, we can see that in the Americas, most prevalences are around in between 10 and 30%, in between mild and moderate, as a problem of public health significance. But we need to keep in mind that there are within the countries a lot of inequities, and that there are vulnerable populations, especially Afro-Americans and indigenous populations, that have higher rates of anemia as the average of a country. Here we can see the same data of children, where in many countries it's a mild public health problem, but in other countries it's a problem of moderate public health significance. So it remains an important problem. The main recommendation to address anemia is the supplementation with iron and folic acids in women of reproductive age, especially in pregnant women. And we have there a high rate of implementation of the Americas of 89% of that intervention of the Global Nutrition Policy Review of a few years ago already. So we're doing better than the average of the world. And we also have other interventions which apply in areas where anemia is above 20 or 40%, and those include the supplementation of iron in pregnant women of reproductive age, and supplementation with iron in children, and also with micronutrient powders in children and in areas of higher prevalence of anemia. So it's important to have good data to know which interventions to prioritize. The Americas also has a very high implementation of food fortification. Actually, we always see supplementation as like an immediate solution, food fortification as a solution, let's say midterm solution. And then in the end, what we like to have is dietary diversity, and have really the iron and the micronutrients from foods. No, that's the final objective. But meanwhile, we have these other interventions which are also useful. So wheat flour fortification is very common in almost all countries of the Americas, and it often includes also other micronutrients like folic acid or vitamin B12 and zinc sometimes. Then we also have, especially in Central American countries, maize flour or cornmeal fortification. And in some countries, there's also rice fortification. Here we can see let's say, the coverage of those policies in different countries of the Americas. When choosing a vehicle for food fortification, it's important to choose a food which is commonly eaten, especially by the most vulnerable groups, so that we are really reaching, let's say, the normal people and not only the persons which belong to higher socioeconomic groups. And we also don't want to change their dietary pattern. So it's important to choose like a food that is of massive consumption and also to implement it in a mandatory fashion. So we make sure we have a broad coverage of the population who most need it. These are some barriers we have to progress. Over the last decades, we have heard that we did reach important reductions, but currently the descent of the anemia prevalences is like slowing down. So first of all, it's important to have good information on the causes of anemia, and a problem that there are challenges in measuring hemoglobin and in determining the underlying causes, because it's not only iron deficiencies, but there are a range of other causes, including those that have to do with infections and genetical um, causes. And in general, it's a marker of poverty and low socioeconomic development in many countries and of inequities. So data are really important to look at the underlying causes of anemia if we want to have further progress. Apart from that, well, there has been a lot of emphasis in preventive and therapeutic interventions at health services, but many people, and especially the most vulnerable people, don't attend the health services. So that's another issue. And often when they do, in the case of pregnant women, they do it at a very late stage of their pregnancies, while they already should have started the supplementation. It's important also to recognize that coordination among different programs and sectors is needed. And we have an outdated narrative around anemia, which is basically solely focused on the need to provide more iron without taking into account the underlying causes. We also need to develop more research and learn from existing programs. To summarize the challenges, often micronutrient deficiencies, including anemia, are not recognized as a public health problem, and the important health and economic consequences are not recognized either. As I mentioned already, it's not only about a low nutrient intake, but other factors like infections, obstetric and gynecological disorders, and inherited red blood disorder. It is like a mild or moderate public health problem, but there are important differences between and within countries. And to reducing anemia further, we require multi-sectoral collaboration to address the social determinants of health, including poverty, social exclusion, and gender. Then also we need to be careful with the market-driven fortification of ultra-processed foods, which is often used to market their foods, which are often high in fat, sugar, and salt. And when they fortified it with iron, it doesn't become a healthier food item. And apart from that, often the levels are such high that there can be even a risk for health. So we need to set safe maximum limits for fortification if it is market driven. Because of that, we prefer, let's say, to use the massive staple foods and have a mandatory fortification of the staple foods without the need to look for this foods which are just for a small segment of the population who can afford it. There is a comprehensive framework. Lisa will speak more about that, but as you can see, all the sectors that should be involved, including the labor, trade, and industry, the need to empower girls and women, and work with companies, the work environment, health and nutrition, which is much more than supplements as well. The food and agricultural sector to really increase production, have a diversified, healthy and sustainable diet, promote women's education, which is a very important marker for development in general, improve water and sanitation, and also social protection, especially of the most vulnerable groups. Opportunities, we will hear a lot of this in this webinar, especially the framework on accelerating anemia reduction. And also we will speak about this new guideline to define hemoglobin cutoffs to define anemia in individuals and population. And I want to mention as well that both of these documents are available in Spanish as well as, and we can share the links with you. WSO is developing implementation guidance. Apart from that, PAHO works with the UN Regional Interagency Task Force. We will hear about this as well in this webinar, which is to really transform food systems that will allow for a healthy diet that both prevents undernutrition, micronutrient deficiencies, and as well overweight and obesity and the diet-related NCDs. For this, we need to transform our food systems and make it more balanced and more variety and more sustainable. Thank you very much for your attention.
Thank you very much, Leonard Levine, PAHO's advisor on food, nutrition, and physical activity in schools. And we're going to move on now to a presentation by Dr. Maria Nieves Garcia Casal, who is a scientist in food and nutrition actions in health systems at WHO. I will just remind you while she joins us, you can place your questions in the Q&A. Okay. Please go ahead.
Just a second. I'm trying to share my screen. Hello, everybody, in the meantime. I don't know. I don't see the screen. Do you
I'm
see?
seeing something, but not your presentation just yet,
Oh,
just a line.
I can help you sharing if you need.
Yeah, because it's
Okay.
all this practicing and then it's not working for me. I don't know why, but yeah, please help me. If you have my presentation there, I think it's okay. Now?
We're seeing
Everybody?
it.
Okay, perfect. Hola, buenos días. Encantada de estar aquí. Muchísimas gracias por la invitación. Y pues.
Thank you very much for the invitation. It is a pleasure for me to be here in these brief minutes. I'm going to start sharing with you the next slide, please. I don't have any control, right?
Okay. Los objetivos de esta
The reasons for this guideline in reference to be able to define anemia in individuals and populations has the objective of improving the diagnosis of anemia throughout a group of recommendations, which is what I'm going to give you more detail here, and also better approaches for its measurements, both in people and also in populations. This guideline also includes the implications for investigation. For example, the original idea of these guidelines was to be able to base the cutoff points and functional points, but the evidence was not enough in reference to this group of data in all of the conditions, and therefore the cutoff points again are based in statistics, in the cutoff point statistics. And this also includes considerations for the implementation and evaluation. Next one, please. I am now going to focus on the different recommendations in reference to this. I'm going to see what each one of these recommendations consists of and what are the implications, practical implications of being able to apply these new recommendations. In reference to the cutoff points for hemoglobin to be able to define anemia, which was the objective, the main objective in reference to this. And like I mentioned, is to be able to look for functional results, but finishing with cutoff dates from the statistic, and it was seen that these modifications should be done. However, the evidence would allow us to be able to have changes in a group, in an age group, because in another one, it was about putting in use a cutoff point that already exists in different documents from the WHO, and that would actually show the cutoff point for anemia throughout the second trimester of the pregnancy. That cut was already there, and actually this was lost a little bit, but it is one of the changes of this new recommendation. And the other one was if it is completely new. All of this is based on the evidence available in healthy population. It is the cutoff point from the children from 6 to 23 months of age. The previous table would consider only one group that was going from 6 months of age until 5 years of age. There was a lot of interest in separating these two groups. So now it's between 6 months and 2 years of age, and 2 years of age, and 5 years of age. And also another recommendation in reference to the cutoff points are the changes in reference to severity of the anemia from the individual perspective. In the following slide, I can show you what I'm making reference to. This is a table of the cutoff points for anemia with the severity at an individual level. And I don't know if you can see this, but here in red, we're able to see the group in which we're able to establish a new cutoff point for this age group between 6 and 23 months of age, which is of less of 105 grams per liter, and the second trimester of pregnancy, like we mentioned, in which it is the same cutoff point under 105 grams. And this is a cutoff point that had already been established as an opinion based on experts, but here in the evidence it is being showed that it is suitable to be able to use this throughout the second trimester. As long as there is data regarding this, it is not always possible in all the surveys to be able to have data among the 3 trimesters of the pregnancy. Next one, please. After we have established what are the cutoff points, and this is the base table where I've already mentioned, we began to be able to analyze all of the evidence in reference to what we know, which are determinant points in the concentration of hemoglobin. Hemoglobin is being affected by the elevation of the residence location. And this table that is being presented today here in this slide is the recommendation, which is about making adjustments for elevation in the place of residence. And it is new in reference to the part that it changes considerably the cutoff points that we previously had. This is possibly the change that may be affecting these parts of anemia at a population. And what are the changes? Well, the changes are first that there are adjustments as of the 500 meters of elevation. Before it would begin at 1,000. Right now, we have an additional group in which we can have the adjustment between 4 and 8 grams of hemoglobin in reference to being able to receive them. The other adjustment that is also important is that the adjustments are relatively large in the population groups that reside under 3,000 meters. And this is included in reference to this part. And this is in reference to what is being affected to this end. And these adjustments that were actually very important of up to 40 grams per liter in reference to the elevation of the place of reference are a little bit minor. This, as we see, has certain implicancies that we are going to mention at the end. We are seeing this table in reference to being able to have the individual value. We are able to see here there's a value, and also from the table that we mentioned with these two parts, we're adding this ends. And this is all seen in the calculation of the rest of the population that does not have any issue or any adjustments due to elevation. And also another thing here is the formula in reference to what countries are needing to do to be for each one of the hemoglobin values for them to be able to have the adjustment. They have it here as a first title. I don't know if you can see it, but here is the formula that we use in reference for this to be applied for each one of the points of the data that we have. In the next slide, we have the
So in this slide, we have the adjustments on the effect of using cigarettes. We know that this type of habit influences in hemoglobin. And sometimes we need to correct this because in this case, values have not changed with regards with the previous chart, but apparently when we had the previous guidelines, all the cigarette packages had 20 cigarettes. That's not the case at the moment. That's why the chart now shows the correction per numbers of cigarettes, right? It's 10, more than 10, or minus 20. So now we need to add the main values into this chart. We also have a formula that would help us explain how do we reach these values. We also have two main adjustments, which is something that we discussed. These are adjustments per infection and inflammation, and adjustments on genetics, race, or ethnicity. And that's why we decided that there was not evidence enough to show a formula or an adjustment. Cases of infection or inflammation could come from different causes, but talking about ethnicity, this is a social construct because you cannot say, okay, this is a completely Caucasian person. There's always some influence of other ethnicity. So, how could you define someone's race with quite accuracy? So, that's why the recommendation is not to have any more adjustments until having more evidence. Another point of debate was how do we measure hemoglobin? The effect on intervention, whether hemoglobin is measured on one way or the other, could impact the effect of a certain intervention. So the standard recommendation is to use venous blood with blood analyzers and quality control actions. We have some differences, of course, some errors are random, and sometimes we cannot do the capillary connection. That's why we recommend using venous blood. Talking about automatic hematologic analyzers or blood analyzers, we understand that we cannot keep the the cold temperatures. So this needs to be standardized. We need to have strict quality standards. And something that we forget is training of people that are going to take these samples. A new recommendation is related to impact on interventions. How are we going to measure the nutritional aspect on the vein? The recommendation is that in addition to hemoglobin, we need to analyze other factors. The anemia in this case is not only iron deficiency. Based on our own reality, we need to think what are the other markers that are relevant to measure nutritional interventions on any kind. And final recommendation before my final remarks is the relevance of anemia for public health. In this first chart, I show you how severe anemia was. It was mild, moderate, or severe. But we also have severity of anemia in public health. Like what's the percentage of a country to say that we have a severe public health issue? Recommendation of the group was to keep current classification of safety when it comes to public health. That means that there's no problem in public health if the prevalence is less than 5%. It's moderate from 5 to 20, mild, sorry, 5 to 20, moderate to from 20 to 40. But we're going to have a severe problem where prevalence is more than 40%. It has worked like this because this is the way that countries have been keeping or keeping track of such information. However, information is not relevant to have changes. Whenever we have evidences that show that this could be different, I'm sure that we are going to be able to do this change. Now, practical remarks. Prevalence is going to be minor with regards to what we have previously estimated. It's going to be less for children from 6 to 23 months. We're going to have less pregnant women in the second trimester due to the same aspects that we just mentioned. Prevalence of anemia is going to be greater for the people that have diagnosed with anemia as well. And it's going to be less talking about people that live over 3,500 meters of altitude. What are the considerations for the transitions of applying this? Well, this could have great implications or implications considering what could be the impact of the problem. And on some time now, we needed to do this drill of measuring prevalence on both models, on both areas, in order to have a transition towards the values for children of 6 to 23 months. Particularly, it would be of use if we're doing a strengthening program. Sometimes we lose the effect of intervention and the effect of those changes as well. And to conclude here, on how should we guide these guidelines, well, we have an updated CAT values, and this is going to improve the diagnosis along with other remarks. For example, remarks or consideration measuring hemoglobin and the transition towards the new estimations for countries should be done with the analysis of data, understanding how it is related to other conditions in the country, the adjustments that consider elevation effects, and using cigarettes is going to impact greatly on the population. Another aspect is the standardized measuring method that would improve data reliability. It's important to have a good data management, understand the source of data, and some things could seem simple. For example, having blood analyzers, but we need proper personnel that is going to find the numbers of hemoglobin. Hemoglobin is still essential to evaluate the impact on interventions, but hemoglobin, along with other markers, particularly if you have countries related to having lead-related issues in those countries. So we need to understand what's the source of the anemia. We need to have data that could guide us towards the origin of anemia. So classification of anemia in public health will keep going until we have new evidence, particularly in the assessment of what we're doing and also the changes. I would like to mention that I have good news. In the last 48 hours, I just received this link because the guideline is in Spanish. Sometimes we only have an executive summary, but these guidelines are completely translated into Spanish, and I think that is going to be of use for the region. I would like to thank you for your attention.
Thank you so very much for your presentation, in which you guided us through the measurement of anemia and the WHO guideline on the HB cutoffs. All right, so we're going to move right along, and we'll try to make up some time along the way. Our next presenter is Dr. Lisa Rogers. She's a technical officer at WHO on food and nutrition actions in health systems. And as she joins us, I'll remind you, keep putting your questions in the Q&A. And I'm sure you know by now that translation is available in English and Spanish by clicking the globe at the bottom of your screen. Over to you, Lisa.
Great. Thank you so much, Audrey. It's really nice to be here with everyone today. So I'm representing an interdepartmental working group on anemia at WHO, where I come from the area of work of nutrition, but my colleagues come from different departments such as malaria, neglected tropical diseases, as well as reproductive health, maternal, newborn, and child health as well. So what we did is we came together a few years ago to see how we can address anemia differently and focus more on a comprehensive approach. You've heard about the World Health Assembly Global Nutrition Targets related to anemia, and WHO periodically estimates the global prevalence of anemia. Within these targets, they've recently been extended to 2030. So what I would like to do is just show you the trends in the prevalence of anemia from the time period of 2000 out to some predictions that go to 2030. Now, at the very top line, you'll see is the data for children in yellow. Red is for pregnant women. The pink line is for women 15 to 49, and then the gray line is just for the non-pregnant women. And then you'll see that orange dotted line there, that shows the World Health Assembly target of a 50% reduction in anemia in women between 2012 and 2030. So despite some early progress there in the early 2000s, there's been a bit of a reversal of trends to where we're now seeing an upward trend in the prevalence. And most countries are off track to meet the global nutrition target by 2030. And this is illustrated for the women of reproductive age in that pink line in the middle, showing that in 2012, there was about a 28% prevalence of anemia estimated. And in 2023, which is our latest data, it shows an estimate of 31%. Now, based on these trends, we project that this will rise to 33% in 2030 if we don't do anything. So this is a global view, but for the Americas region, it's estimated that nearly 1 out of 5 women 15 to 49 years of age are being affected by anemia, giving about 47 million women affected. So I just wanted to summarize a little bit of what Leo has also already mentioned about why do we think that we haven't been able to make more progress? Really, anemia is much more complex. It has a more complex etiology. It's not just due to iron deficiency, but there's also other nutritional deficiencies, the infections, the chronic diseases that we need to address simultaneously. In some areas, there is outdated or missing data on some of the underlying causes and the risk factors, or the data might be available, but it's just not being brought together to inform the different interventions and programs. And as Maria Nieves mentioned, we continue to recognize the variability in hemoglobin measurement due to the insufficient access to equipment, blood sources, whether it's capillary or venous blood, and the different quality control measures that are being used. And we also need much more validated diagnostic tools to really get to the underlying drivers of anemia. There are also the programmatic challenges, so low coverage of some of the interventions that we know do work. We might have poor quality of the products or the interventions. We need much more education, and we need more coordination, I would say, across the program so that we can drive that effective coverage. So it was pretty clear to us that we needed to have a different approach to address anemia. And that's when the different departments within the organization came together, worked with some of our partners to develop background papers for some priority areas of work. And these were on the main determinants of anemia, again, looking at the risk factors as well as the underlying causes. We looked at some of the challenges in the diagnosis of anemia, as was mentioned. We also looked at the different interventions for prevention and management of anemia. We also looked at how those interventions were being delivered within programs and across sectors. And then these papers were published together within a supplement in the Annals of the New York Academy of Sciences. The QR code there will take you to that supplement. And all these papers were really instrumental for informing the development of this comprehensive framework called Accelerating Anemia Action, the framework, Accelerating Anemia Reduction, the framework for action. So these were really important papers for that. We're really excited that the African Union Commission had taken this global framework and converted it to a strategy for their continent as well. And it's really nice to see the Americas region having this as part of their roadmap as well. So I think there's a lot of momentum and excitement being built off of this work. So I just wanted to go through an overview of the framework that brings together some of those priority areas that were highlighted in the background papers. So if we start at the bottom, we just recognize that the framework emphasizes the multiple disciplinary approach. And that's where we think that we need input from not only the health and nutrition sector, but food and agriculture, water, sanitation, hygiene, the education, the social protection, labor, trade and industry, as well as finance. Those are all really important for us to think through all the different causes and the risk factors. Then it lays out the 5 different action areas that are all needed to drive success in addressing anemia. These action areas are really the main focus of the framework, so I will just take a minute to expand on these. The first action area is ensuring that we have those right diagnostic tools available to collect the data, to analyze the data, and to interpret it appropriately. We need to have that clear understanding of the prevalence as well as the local causes and risk factors that are driving anemia for that particular setting. The second action area really focuses on the use of that information to select the appropriate range of interventions that best respond to those local needs, not only responding to the direct causes, but also those risk factors that we mentioned. The third area calls for collaboration in delivering the package of prioritized interventions, building on and improving where needed the existing platforms that are already within the sectors, but really thinking about how do we reach the people that need it the most. And that fourth area calls for the programs to be supported by strong leadership, investment, and communication among the different contributing sectors. And that last action area reminds us to continue addressing some of the research gaps, making sure that we continuously learn, innovate, and ensure that those innovations are not only effective, but accessible and appropriate for the context where anemia is most prevalent. And with these action areas, what we're seeking to do is what's in that blue box there, and that's the improve the sustained, equitable, and effective coverage of the different priority interventions that not only do the diagnostics, but the prevention and the treatment as well. And by achieving that, we feel that we will make much more progress on those direct causes of anemia. So how do we improve the micronutrient status, reduce infections, inflammation, and chronic diseases? How do we reduce the gynecological obstetric conditions and improve screening and management of inherited red blood cell disorders? By doing that, then we can optimize the hemoglobin synthesis, prevent the excessive destruction of red blood cells, decrease blood loss, and then have much better results in achieving the global targets and improving health and well-being of the populations. So as mentioned by Leo, we have the whole framework and we have different interventions that are suggested for each of the different sectors that are involved. But we also tried to organize the interventions by the outcome, so those 4 different outcomes that I mentioned, and try to put those into a table that suggests different actions for each of the different sectors for each of the different outcomes. For an example, for social protection, and if we think about how do we reduce the gynecological and obstetric conditions, making sure that we promote the gender equality and women's empowerment, how do we support the income generating activities, alleviating poverty? For education, again, how do we promote the girls' and women's reproductive health education, social and behavior change about anemia and the relevant interventions? For WASH, improving the hand hygiene practices, safe sanitation. And then for health and nutrition, how do we assess and manage the anemia, prevent, screen, and manage chronic diseases, improving the menstrual health, including prevention and treatment of the heavy menstrual bleeding, preventing early pregnancy and poor reproductive health outcomes, promoting birth spacing, access to the voluntary use of modern contraceptions, really thinking about the antenatal and postpartum hemorrhage and how we can both prevent and treat it, and then reducing the unnecessary cesarean section. So we have a table like this for each of those 4 different outcomes, and I just wanted to give you an illustrative example of what is inside the different, inside the document of the framework. So I want to leave you with a few key messages from the framework. We went through it very quickly, but it does recognize that anemia is a cross-cutting issue. It suggests the essential action areas and the interventions to address it based on country-specific data. I think that's really important. And also thinking about what are the existing delivery platforms that you can utilize to deliver these interventions. We know that anemia has been primarily addressed through the nutrition lens, and this is very important that we continue to do this, but it's not going to be sufficient by itself. We really need to think about how do we address all the different causes of anemia so that we're effectively preventing it and treating it. And then how do we deliver that effective coverage for the different interventions that are needed to address anemia at those key moments in the life course. So we have to think about not only, the children and adolescents, pregnancy, post-pregnancy, it's really through the whole system that we need to think about. And then how do we make sure that we have that strong leadership and collective action? That's really emphasized that we need the advocacy around this. We need to make sure that all the different relevant sectors are involved and contributing to this area. We know that it's not just the nutritional issue, but it's a developmental issue. So we really think it's going to be foundational for how we think about broader health and equity goals as well. So we mentioned that we're developing implementation and monitoring guides because the framework itself really focuses on what to do. And with the implementation guides, it will focus on mostly on how to implement the framework. So much more of the practical instructions and tools to implement the framework and also to monitor progress. It should be able to give more indication about how to implement the recommended interventions and policies. Many different partners have come together. We're developing the implementation guides with several departments within the Anemia Action Alliance, and I'll get to that in just a minute. But they're all coming to the table with different tools and resources that are already available, but let's see how to use which tool in which setting. So really providing a little bit more information on how to facilitate this process. We'll recommend a set of priority indicators to monitor the policies and programs and explore the use of scorecards and dashboards. So we're in the development process. We welcome the co-design of these things. We really want your input, so please don't hesitate to reach out if you have any inputs that you would like to become involved in developing these guides or reviewing them, pilot testing them. We're really grateful to all those who've contributed thus far. I mentioned that the global nutrition targets have been extended to 2030. I also wanted to mention that we've just released this brief that talks about the extension, but also about some new operational targets that we've developed in order to try to see how we can facilitate progress in this area. One of those targets is an increase in the percent of pregnant women who are consuming at least 90 doses of iron-containing supplements to 55% by 2030. And the second is to increase the percent of women with minimum dietary diversity to 85%. So these are two new additional targets that we would like to start monitoring as well. I'll just say a few words about the Anemia Action Alliance as well. This was established in 2023 as a network of partners who are committed to supporting the different countries in reducing anemia. It's hosted by WHO, but it's in close collaboration with UNICEF as well. We currently have 22 members, and there's 3 working groups that are supported by a secretariat and a steering committee. And those who are eligible for participation includes different agencies affiliated with governments, intergovernmental organizations, non-state actors. That includes the academics and civil society as well. The mission of the Alliance is really to foster that accelerated efforts to reduce anemia, including through the implementation of the comprehensive framework. And what we'd like to do is really we're focusing on improving the global awareness of anemia, strengthening collective action to support countries, and also trying to mobilize the investments in reducing anemia. The working groups bring together some of the core participants, and these participants have the similar interests and expertise. They're meant to share the information and collectively work on specific activities that align with the mission. And these working groups are really focused on supporting the implementation of different programs and policies. And this working group is led by Nutrition International. We also have an investment working group led by the World Bank and a research working group that focuses on issues that are felt to be constraining progress in this area the most. And this is led by the African and Population Health Research Center. We also have an advocacy and communications group that's really meant to engage in countries and different actors as well. So I just wanted to leave you with this thought that, we really feel that we can work much faster and go farther if we work together to ensure that all those who are being affected by anemia do receive the care and support that they deserve. We aim for this to be a powerful platform for countries and agencies to be able to share experiences, learn together, reduce duplication of effort. And we feel that if we can align our efforts, we can get back on track to reduce anemia. Here's a QR code to our website. There's lots of different resources around anemia. There's a repository, all the different documents on anemia. We have the LinkedIn account as well that we tend to send out different announcements of events. So we encourage you to get involved. We appreciate the government of Peru who's been involved and really actively working with us, and we welcome more members as well. And I'll just leave you with this notification that the Lancet Hematology Commission is also having a North American launch. And so if you're interested in hearing much more about anemia, please go ahead and scan this QR code and register for that, which will be held on November 18th. So anemia has had a lot of interest, and we hope that you can join in. Thank you very much.
Thank you very much, Lisa, for your presentation. Okay, had a little problem there. Okay, thanks so much for your presentation on the WHO's comprehensive framework for action on accelerating anemia reduction. We're going to move on now to a presentation on PAHO's food and nutrition systems approach to address malnutrition in all its forms. And that presentation will be made by Leslie Vihar, our technical officer on malnutrition and food systems. Over to you, Leslie.
Thank you very much, Audrey. Sharon, can you please help me to share your screen? Bueno, voy a hablar en español en esta
Well, I would
presentación.
love to speak in Spanish in my presentation, and just to recap on what we were just discussing in this webinar, we are sharing the main interventions when it comes to nutrition to reduce anemia as an immediate action for having supplements, and strengthening as a second chance. And in third item, we have diversity and diversification of diet as a long-term solution. So based on that presentation, I will be focused on this third intervention through this presentation system.
And just to be able to state that the food systems include all of the components, the environment, the population, the resources, the processes, the institutions, the infrastructure, and also the activities involved in reference to being able to establish this. However, this also includes an impact of these activities in reference to nutrition and health, in reference to the social economical growth and sustainability, environmental sustainability, that while all of them are in reference to being able to establish this. This can affect the nutrition in different ways in reference to being able to see that current food systems are making us ill because they are oriented in reference to the productivity and profiting instead of being oriented to be able to promote sustainable acts in reference to being able to do this for the whole population, and in this way being able to prevent or reduce malnutrition in all of its forms. And by malnutrition in all of its forms, I'm talking about overweight, obesity, malnutrition, and deficiency of micronutrients, such as, for example, anemia. And the fact that our current systems are morely focused on the productivity and profits, we are able to see this reflected, or they are actually promoting climate change. They are working on human health, the health of our ecosystems. And this definitely generates vicious cycles of illnesses and lacks of well-being, affecting mainly the population groups that are most vulnerable. Next one, please. And well, there are different, or we can actually summarize this into an interconnected and interrelated ways throughout which the food systems have a negative effect in the health and nutrition. I'm not going to go in detail on any of these, but I would like to highlight here some of them. For example, the first one that speaks about the non-healthy diets, which contribute to the malnutrition in all of its shapes. On the other hand, the second way where we're actually seeing, I don't know if you're able to see my, oh yeah, sorry, no, Sharon, you can't see it, but the second way where we are able to see the contaminated food and unsafe food, which makes reference to situations in which the food and water contain infectious or toxic hazards. For example, in reference to bacteria, viruses, parasites, or chemical waste, which is also a cause of illness. And this can cause deficiencies, and that is why also it is important to be able to highlight this way of interaction or affection. The third way are the zoonotic illnesses and the resistance to these antimicrobians. And finally, the fourth way, we can observe that while the current systems, such as what it was commented, contribute to the contamination and also the degradation of the planet. And this is produced basically due to the monocultures, the production or intensive agriculture, and the use of fertilizers, as well as products that include heavy metals. And here, in reference to being able to see that this could cause anemia when interfering red globes and also the production of hemoglobin in reference to the metabolism of this. And here to being able to discuss this on a more macro level and as a resource for prevention of anemia. Here, the occupational risk in reference to the physical and mental health of people that are working in the food systems, and in reference to the nature of this work or the conditions in which they work. And yes, it has already been explained by the previous presenters, a very important paper in reference to women, a very important role in reference to women, and in reference to being able to establish in reference to this part, in reference to food. Next one, Sharon. And here in reference to being when we talk about healthy food, what do we mean by saying this? There are four main X's in reference to this being suitable, balanced, moderate, and diverse. The one next one, please, Sharon. And the evidence in reference to being able to establish this part that is going to be rich and cereals such as whole grain cereals, like real cereals, because sometimes in reference to being able to establish this part, and that one to say high in fiber, or some nutritional claims in reference to health and food, fruits, specific vegetables, ones that are low in salts and total saturated and trans fats. And a healthy diet begins from early on in reference to correct milk feeding. And this is going to give us better results in production, health, in reference throughout the whole life. And an important part to what we have here in reference to what are the forces or have iron, MO or non-MO iron, in reference to being able to see this in the small people, which is very much recommendable, and in reference to being able to see this part here and sustainability of the diets. And it is also that we have recommendation of ones that are based on plants, and to be able to establish that they can have very good sources of iron for specific vegetables, specifically those of green leaves. And it's important to be able to combine them with vitamin C in reference to being able to have this bioavailability. Next one, please. And well, what is it that PAHO proposes, or what is that we have to work on in reference to being able to work on health and nutrition? Well, very good. This is something that is also being proposed and promoted by the World Health Organization, and this means that basically there are seven large areas. This is done in an integrated manner, comprehensive manner, and we should promote that the governments have the obligation of looking for the implementation of these recommendations to be able to improve health systems and to be able to see the malnutrition in all of its shapes. First of all, in the first point, we have the fiscal policies for healthy and sustainable diets, where on one end we have the health taxes and the taxes to ultra-processed food and also sugar beverages, but here also we have in reference to subsidies to healthy food. There's a return of these taxes, which can actually help to promote and sustain social programs for support and the fortification of food or of vouchers to be able to have access to certain types of food, etc. As a second point, we have the public policies of acquisition and providing of food services, which establishes nutritional criterias in order to be able to see the nutrition criteria for food that are used and that are sold in public environments, which can be schools, which can be hospitals, prisons, government offices, etc. And these policies are going to help us to be able to see is that there is an increase in the availability of food that actually promotes diets, healthy diets, but that also prohibits or limit the availability of products or foods that are not healthy and would not contribute to the objective and the target. And well, just to not to go on to stopping much this on time, we also have to establish in reference to being able to see this part of food in reference to being able to see the evidence to the control of the deficiencies of micronutrients. But like Leo mentioned, and here in reference to being able to see this part, in reference to being able to be seeing this processed ends, and here in reference to being able to demand this kind of products. And here it is about, and we wanted to show how this portfolio of measures that we have shown in this wider manner is also inserted in the part of the supply chain for food. And here in reference to being able to see this and to the impact of the consumer, that will also have an impact on whether they have a healthy fooding habits or not, and also to be able to have if they already have this in a healthier manner, they will be able to improve their nutrition, their health, and they would decrease the environmental results and the positive economic results. And next one, please. And well, just to be able to share that on behalf of PAHO, we worked on a route map that presents essential elements to be able to propose actions of nutrition within the health sector in reference to being able to have an impact on the transformation of food systems and to be able to get results that are more effective in the control of all of the ways of malnutrition. But here we are going to leave you the document and we're working on a more synthesized summary in reference to what we were able to share in the following months. Next one, Sharon, please. And finally, and just to be able to finish this presentation, we wanted to tell you that PAHO forms part of this interagency work in reference to the United Nations regarding food systems for Latin America and the Caribbean, where the main objective that we have within this group is to be able to provide support to the companies, to the countries in their transformation with the objective of making them sustainable and that they are contributing towards a healthy food habit. Next one, please, Sharon. Okay, well, thank you very much for your attention. Over to you, Audrey.
Thank you, Leslie, for your presentation. And we're going to move right along. We have a presentation from Peru, the experience of Peru in preventing anemia, the progress and challenges they have made. And our presenter will be Esther Molina Moscoco, and we welcome her. Over to you.
Muy buenos días con todos los
Good
presentes.
morning with everyone here
Voy a
present.
proyectar
I am now
segundo,
going
por
to
favor.
start sharing. Just 1 second, please.
Me confirman que si se
If you
visualiza,
can
se
please
escucha.
confirm if you can see this.
Yes, we can.
Muchísimas gracias. Muy
Very
buenos días
good, thank
nuevamente
you.
con todos los presentes. Reciban el cordial saludo
Here
del
we can
doctor
receive the
Luis Quiroz,
greetings from
ministro de
Dr.
Salud.
Luis Quiroz,
Y
Minister
muchas
of
gracias
Health,
por la invitación.
and thank you very much
Como
for
nos
the
han pedido,
invitation.
charlaremos
Well, we've
acerca de
been
las
asked to
experiencias del
discuss
Perú
the
en la prevención de
experiences of
anemia,
Peru in the
progresos y
prevention of
desafíos.
anemia, progress, and challenges.
Como podemos ver acá,
As we are able
hemos
to
querido
see
iniciar
here,
un
we
poco
wanted
viendo
to
lo que
begin
es
seeing what
la
has to
evolución, la
do with
tendencia
the
de la
evolution and the
prevalencia de
trend of
anemia,
the
como
prevalence
vemos
of
en los
anemia.
últimos años
As we are
ha
able to
ido
see in the past
incrementándose
years, this has been
y
increasing.
básicamente en el
And
2023 y
basically, in the year
2024 ha habido un
2023 and
incremento de
2024, there has been an increase
0.7
of
puntos porcentuales.
0.7
De igual
percentual
forma,
points.
en el área rural también hay un
And also in
incremento
the
y
rural
una
area,
leve
there is an
disminución en el
increase
área urbano.
and
Pero si
a
nosotros
light decrease in
observamos
the
el
urban area. But if we are
incremento en
able
relación
to
al
observe this in
2024
reference
ya
to
por grupos de edad,
2024 and per
vamos
groups
a
of
ver
age,
que el
we are able
grupo
to
de
see
6 a 11
that the
meses de
group
edad
from
es el
6 to
más
11 months of
afectado,
age is
con
the
una
ones that is most
prevalencia del
affected with a prevalence of
51.8%, y en
51.8%.
caso de los niños de
And in the
12 a
case of
23
children from
meses y
12 to
niños de
23
24 a
months
35
old
meses
and
también supera
children
el
from 24 and
30%.
35 months old, they
Esto es
overcome
importante porque
30%
a
as well.
nosotros nos
This is
permite
important because this
focalizar
allows
nuestras
us to be able to
intervenciones
focus on
en
these
materia de
interventions
políticas
in reference
públicas.
to being able to see public policies
También
as well. And
mostramos
also,
esta gráfica
we
en la
were
cual se ha
showing
estado
this graph in
analizando
which we have been
la
analyzing
evolución de los últimos
the
3 años, y
evolution of
como
the
podemos
last
ver
3 years.
acá,
And as we are
tenemos
able to see,
7
we have
departamentos en el
7
país que han
departments in the
disminuido la
country that
prevalencia
have
de
reduced the
anemia en
prevalence of
años
anemia
consecutivos,
in
como Callao,
consecutive years, such as
Huancavelica,
Callao,
Huánuco, La
Huancavelica,
Libertad,
Huánuco, La
Madre de
Libertad,
Dios, San
Madre de
Martín
Dios,
y
San
Ucayali.
Martín, and
Y
Ucayali.
tenemos 10
And we have
departamentos
10
que entre el año
departments that
2023 y
between
2024 han
2020 and
disminuido en la
2023
prevalencia
have
de
reduced in
anemia.
reference to the
Y
prevalence of
uno
anemia.
de ellos
And
es el
one
Lima
of them is
Metropolitana, que ha
Lima
bajado la anemia de
Metropolitan
27
that
a
has reduced
24, es
anemia
decir, en
to from
2 puntos
37 to
porcentuales.
24 and 3
¿Por qué es
percentual
importante
points from 27 to
mencionar esto?
24.
Porque
Why is
recordemos
it
que
important to
Lima
mention this? Because we must
Metropolitana
remember that
alberga
Metropolitan
una
Lima
buena
is able
proporción de
to have
niños,
a high
justamente menores
level
de 3
of
años,
children under
aproximadamente
3 years of age, approximately
24.1% de toda la
24.1%
población.
of the whole population.
Sabemos que la anemia es
We
un
do know
problema
that anemia is an
de salud
issue
pública
of public health
multicausal,
that
multisectorial,
is
y requiere el
multi-sectorial,
abordaje y
and
compromiso de
it
todos los
requires the
sectores
commitment of
involucrados,
all
las
of these
autoridades
sectors involved,
políticas,
political
para hacer
authorities,
frente justamente a estas
to be
determinantes.
able to see
En
these
nuestro país, la
determinants in our
inseguridad
country.
alimentaria alcanza el
The in the food
51.6% de la
insecurity
población,
is a
el
20
17.5%,
51.6%
son,
of the
tienen hogares
population,
hacinados, la pobreza
17.5%
monetaria
are
también alcanza
multi-households,
el
27.6 is in
27.5%, una
monetary
ligera
poverty,
disminución en
a
comparación al
slight decrease in
2022, pero de
comparison to
todos modos
2023. But
hay
either
población
way,
muy
there are
vulnerable que esto
populations that are
afecta la
more,
calidad de
very
la
much
alimentación,
vulnerable in
como han estado
reference
hablando
to
mis
what we have been saying
antecesores, y
in
también sobre
reference to our
todo
previous
los
presenters,
alimentos de
and
origen
also the
animal,
food of
que
animal
son claves para
origin,
el crecimiento y
which are
desarrollo
key
adecuado de
for the
nuestros niños,
correct growth and
gestantes y
development
adolescentes. Aquí
of our
también
children,
tenemos hogares con
adolescents, and
acceso
pregnant women. We have
a agua para
households
beber
with
con
access
suficiencia de
to
cloro,
water
solamente tenemos el
to drink with sufficient
72.8%,
of quorum. We only
y
have
también un aspecto
52.8%, and also
importantísimo es el
aspect
tema
in
de la
reference to being able
educación
to
en
see
la
what has to do
población
with
femenina.
education
Bueno,
and
estas son
population.
cifras, como
So
hemos dicho, como países
these are
necesitamos
numbers
trabajar
that, as a
juntos
country, we need to be able
para
to work
mejorar
with
esa
to be able
situación.
to improve the
En ese
situation.
sentido, se ha hecho un esfuerzo en conjunto con los sectores para la aprobación con decreto supremo 002-2024 del Plan Multisectorial para la Prevención y Reducción de la Anemia Materno-Infantil.
For the
Desde un
prevention
inicio
of
han
anemia.
participado
And here
6
we've
ministerios,
participated
como es el Ministerio
and
de
in
Salud,
reference
el
to the
Ministerio
Ministry
de
of Health and
Gobernación,
also the Ministry of
MIDIS,
Production
Vivienda,
and
Ministerio de
Development,
Agricultura y Riego,
Housing,
Educación,
Irrigation,
y también el
Education,
RENIEC, que es
and
importante para el tema
it is
de los
important to be
DNIs.
able to see this
A
for
la
the
fecha estamos
IDs.
trabajando
And
de
So
to
up
this
forma
to this
muy
date, in
state,
reference
we
to
articulada
being able to
are
work in an
con
working
todos
articulated
los
manner,
articulated
servicios que tienen un
to
papel muy importante. Salud también, que tiene una población
Having a salud,
aproximadamente
it
del
has a
16% y también
population
su salud,
of
ya que ellos tienen
10%.
instrumentos de
So salud,
supervisión a
it
nivel
has
nacional, a nivel
instruments
de las
nationally,
keepers que también
and
están viendo el tema
we
de
have
anemia.
the
¿Por
people
qué
that
es
are dealing with
importante
anemia.
un
So
plan
why is it
multisectorial?
important to
Porque
have a
justamente va
multisectorial
a abordar
plan?
las causas de
Because
la
it's
anemia,
gonna tackle
va a
anemia,
articular, va a
it's going
fortalecer
to
el trabajo entre
articulate,
los
it's going to
diferentes
strengthen
sectores y aliados
works without the
estratégicos
different
y también va
sectors and
a
allies.
justamente
It's
un aspecto
going
muy importante es el
to
tema de presupuesto para el
adjust the
cumplimiento de
budget
metas,
for
actividades
compliance of
programadas dentro
goals,
del plan
activities,
multisectorial y
programs
también
within the
permite sensibilizar a las
multisectorial plan, and it
autoridades y
enables
sociedad civil
to
en la
create
lucha contra la
awareness
anemia.
for
En
the
este
civil
plan
society.
multisectorial tenemos
In
7
this
objetivos que
multisectorial
va desde
plan,
prestaciones,
we
ve
are
el
going
tema
to
de agua y
discuss
saneamiento, el tema de
water,
alimentación,
sanitation,
tema comunicacional, que cada uno tiene sus
communication
actividades
that
definidas.
we have defined.
También tenemos una
And we
participación
also have
activa en espacios
active
muy
involvement
importantes como
in
es la
spaces that are
Comisión
relevant, like, for
Intergubernamental de Salud.
example, the
Aquí se reúnen
Governmental
las máximas
Health
autoridades
Commission. We
presidida por el
have
ministro de
the
Salud con los
authorities
directores
with the
de las
Ministry of
DRESas,
Health,
GERESAS, DIRIS a nivel
the
nacional y toman acuerdos
directors of the
en el
different
marco de las políticas de salud y dentro de
departments.
ellas
They
está
take
anemia y
agreements,
también hay
and
una
within
participación
those
en el
agreements, we have
Consejo de
the
Estado
agreement.
Regional
We
donde
have an
está
involvement with the
el
Regional
presidente de la
Government
República y los
Council,
gobernadores
where
regionales.
the
Son 14
president of
regiones
the
que han asumido
country
compromisos en
gets
relación al
involved.
equipamiento,
And
lo que es los hemoglobinómetros y equipamiento
talking
para
about
diagnóstico etiológico en este
hemoglobin
espacio de los
meters,
consejos de
we
Estado regional.
basically receive training on that sense.
Sabemos que en caso
We
de
know
nuestro
that
país hay una
in our
realidad muy
country
diversa
we
en los
have a
diferentes
diverse
departamentos.
reality
Madre de
in
Dios,
the
Loreto,
different
Ucayali, es
cities. For
diferente a la
example,
situación de
Madre de
Puno, de
Dios,
Piura.
Loreto, Ucayali,
Por ello es que lo que se ha
and
buscado es que cada región también pueda
we
identificar cuál es la
are
causa,
trying to
¿no?
see
Habrá
what could be
regiones
the
como Pasco que el
cause.
tema de contaminación de
We
metales
have
pesados es mucho más
regions
fuerte.
like
Entonces, así
Pasco
cada
where we
región
have heavy
puede
metals.
identificar y de acuerdo con los
So
diferentes
each
sectores
region should be able
en el
to
ámbito,
identify
se ha hecho lo que es la elaboración de
and
los planes
learn about
multisectoriales
the
regionales
multisectorial
para
regional
la
plans
prevención y
for
reducción de
prevention
la
and
anemia,
reduction of anemia.
que están alineados al
So
decreto
all of
supremo
this is aligned
002.
with the
A la
Supreme
fecha
Decree
tenemos 10
002.
planes
So we have
multisectoriales
10
regionales
multisectorial
aprobados como
plans
Cajamarca,
that we have
Huancavelica,
activated
Ucayali, Lima Región,
in
Ancash, San
Cajamarca,
Martín,
Huancavelica,
Ayacucho,
Ucayali.
Apurímac,
All of those are
Arequipa y La
regions
Libertad. Son 10 y
in
aquí están los
Peru.
documentos que han sido aprobados
And
con ordenanza
we have
regional. Hay
approved these
11, hay
documents. We
11
have
regiones que
11 regions
actualmente están en el
that
gobierno
at the
regional
moment
para su
belong to the
aprobación, que
regional
esperemos que
government for its approval.
ya en noviembre
We're
máximo lo
hoping
estén
that
aprobando,
in
sino
November
diciembre.
we could
Y
approve
hay 4
this.
regiones todavía que
And we
están en
have 4
proceso de
regions that are
elaboración
still
y
in
que
process of
siguen
elaboration,
recibiendo la
and they
asistencia
are still
técnica por parte del
receiving
Ministerio de Salud y
technical
también en
assistance by
conjunto
the
en
Ministry of
reuniones a
Health
nivel nacional con
and
PCM y con los demás sectores
meetings
hace incidencia
with
que a nivel de las regiones se pueda fortalecer
the
este trabajo
PCM, and
que se está
we
haciendo en
starting
pro de
to
beneficio de la
strengthen this
población
work
más vulnerable, que son
in
nuestros
benefit of
niños,
the
nuestros
vulnerable
adolescentes y nuestras
population. We
gestantes.
have our children, teenagers
También
as well.
en el
And
2024 se ha
in
aprobado la norma
2024,
técnica de
we
salud,
have approved the
prevención y
health
control de
technical
la anemia por
standards,
deficiencia
prevention
de
and anemia
hierro en el niño,
control
la
by
niña,
iron
adolescente,
deficiencies
mujer,
in
en edad
children,
fértil,
girls,
gestante y
adolescents,
puerco. Este es un
women.
documento importante
And this is
porque
a
su ámbito
document
es a
that
nivel
is
nacional
important for
y
us because
prácticamente es una
basically
disposición que se
this
da
is
para
a
para los
disposal
8.056
for more
establecimientos de salud que
than
tenemos como país en el primer nivel de atención.
80,056
Hay varias mejoras,
infrastructures or
pero entre las principales podemos
health
destacar, por
centers that we
ejemplo,
have.
en la norma
And
que se
in the
aborda el
standards,
diagnóstico etiológico de la
we
anemia en el
work with
primer nivel.
etiological diagnosis
Esto
of
es
anemia
importante
in the
porque
first care
permite
level.
identificar la causa de la
We
anemia. Antes lo que
identify
se
the
hacía
cause
era
of
se
anemia
trabajaba con el
because before we
hemoglobinómetro,
used
que
to
es
work with the hemoglobin
una herramienta muy
meters.
importante
Basically,
porque
this
te
is
da
a
los
tool that
resultados
it's
si el niño o
important
la gestante adolescente tiene
because you could
anemia
see
y
if
te
the
identifica
person
el
has
grado de
anemia,
anemia, pero no es suficiente.
but
Tenemos que
it is
saber
not
cuál es
enough.
la causa de la
We need to
anemia y
know
acá se está
what's the cause
trabajando
of that.
con los equipamientos de
So that's why we
evolutiva,
are working
analizadores
with
hematológicos, pero
different
también el médico cuando ve que el niño tiene
tools.
anemia le
When
manda a
doctor
hacer otros
sees
exámenes, exámenes
the
de
children has
actualización
anemia,
importantes
we
como
have
el
other
hemograma,
support analysis, like for example, malaria for endemic areas. We also have pollution by leads. So in the standards, we have incorporated the new guidelines of WHO, and we have adjustments of hemoglobin. So from last years, we have been incorporating this for pregnant women for treatment of severe and moderate anemia. We incorporated the iron. So we are trying to work and do trainings nationally. And we have seen that there is a chance of vulnerable population. In the standards, we have children, adolescents, pregnant women, and we are contemplating women in fertile age or reproductive age, sorry. And this is a meaningful group because sometimes they get pregnant, but they don't know if they have anemia. So it's important to tackle this group. And also we have nutritional care for children and pregnant women. Those are the aspects that we're considering. It's important to mention that we have achieved 433 health systems are gonna have ferritin or hematological analyzers. So that means that we're gonna be covering 30% of establishments, which is important to identify what's anemia. The law or Act 31348, we were able to approve this.
Que justamente sus necesidades nutricionales están incrementadas, sobre todo el hierro, ¿no? Va a contribuir en estos grupos de manera muy importante. También tenemos los lineamientos para la gestión de
we know the guidelines for investment in health and the framework of prevention of anemia. And this is relevant because it enables companies to invest on the health center. And currently we have 8 regions that we have prioritized, and this is being led from the Vice Ministry of Public Health. We have regions like Cajamarca, Arequipa, Cusco, among others. And we have been working strongly with pro-investment unit. We have identified investment projects in which we could invest. For example, acquiring mobile units. This is important because we have resources. We have a multidisciplinary teams. We have nutrition, nurses, laboratories for a period of 5 years. A new project would be the optimizing and rehabilitation and the network of health infrastructure. This is going to help us get closer with the population so they could have integral care. We have 8 regions that have been prioritized, and there are different phases in which we're moving forward. Ucayali has done identification of their own healthcare centers, and the regions that have progress would be Arequipa, Cusco, and Huancavelica. They have a progress of 85%. They are in a phase of prioritization and financial
Entonces,
infrastructure.
también se han elaborado las
So we have
especificaciones técnicas de las
performed
unidades de
technical
laboratorio móvil justamente para
specification
la
as well
adquisición del equipamiento y el recurso
for
humano que hemos
acquiring
estado
equipment and human
conversando.
resources.
Asimismo, esto también crea un
So
compromiso, una
this
responsabilidad
generates
con el
a
gobierno regional para que le pueda dar la continuidad del caso y también
commitment with
ampliar
the
sus
regional
ámbitos de
area
intervención.
in order to have a better intervention.
También se ha aprobado lo que es la ficha de homologación del
We
alimento
have
infantil
a
instantáneo, que es
standardization
clave y que
sheet,
hay que trabajar que
which
las
is
empresas puedan
important,
hacer la producción.
and
Está la ficha y esto va a beneficiar a la
this
población
is
más
gonna
vulnerable, a los niños
be
de 6 a
important
12 meses va
for
a tener un
vulnerable
impacto porque ya
population.
hemos visto que la prevalencia es
We
más del
know that
50%.
prevalence is
Y en
more than
caso del documento
50%,
técnico,
and for
sesiones
the case of
demostrativas de
technical
preparación de
documents, we
alimentos
have
para la población
demonstration
materna
sessions
infantil. También aquí se les
for
enseña cómo tienen que hacer la
the
preparación
population. They
de
know
acuerdo al
how
grupo
they
de
need to
edad, de
prepare
acuerdo a la
according to
cantidad,
group
consistencia,
age,
el personal de salud y bueno, se viene
the
aquí
health
trabajando en la
personnel.
implementación de
And
este documento técnico.
we have been working on
También se
elaborating
está
this technical
trabajando en lo que es el
document.
programa de
We are
incentivos a la
working on
mejora de gestión
incentives,
municipal, compromiso 1.
improving
Aquí
municipal
tenemos un ejército de
management.
actores sociales que vienen visitando a los niños
We
menores de
have
un
been
año y a
visiting
las gestantes,
children that are younger than
justamente brindando
1 year old.
mensajes
We
claves
have
para
been providing
contribuir
key
a la lucha
messages to
contra la anemia.
contribute to
Tenemos
um,
también desde el mes de agosto lo que es la
tackling
implementación de
anemia.
la
From
campaña
August, we have been
multisectorial
implementing the
Niños sin Anemia. Su
multi-sector
futuro depende de ti. Este es un
campaign.
trabajo en
This is
conjunto
Children
con los
Without
ministerios,
Anemia.
con
Their
PCM,
future
en
depends
la
on
cual la
you. And
tercera
basically, we
semana
have
de
been
cada
working
mes se
on
prioriza las
with the
intervenciones
ministry.
vinculadas
On the third
a
week of each
prevención y
month,
control
we
de
have
anemia. Y
interventions
cabe
on
mencionar
anemia.
que hay,
And it's important to mention that
actualmente hay un
we
plan de
currently
cierre de
have
brechas, pero esto está
a
dirigido para
gap
DIRIS
closure
de Lima
system, and this
Metropolitana,
is
que sabemos que
directed
alberga una
to
buena
DIRIS.
población,
We
y
know
aquí
that
se
we
está
have good
priorizando la
population,
atención
but we are
nutricional, teleorientación y
prioritizing
telemonitoreo a los niños
nutritional
menores
care
de
for
36
children
meses.
that are younger than 36 months
Acá tenemos un
old.
panorama
And we
de las
have a
prestaciones que están
scenario of
vinculadas a prevención y control de anemia. Esto es de
everything
acuerdo a la
like
data
to anemia.
GIS-MINSA,
This is
y lo que podemos
according
ver es
to
que hay una
his MINSA.
evolución
And we see that we have
sostenida
an
en el
evolution
tiempo,
which is
¿no? Ya
sustained
sea
throughout time.
en las diferentes prestaciones, pero
Um,
también hay que hacer mención que
and
ha
it's
Just
habido
a
important to
una,
remember
minute.
ha
And
habido
I,
una,
I just want
ha
to,
that
habido
there
una
was
evolución
an
sorry,
evolution.
en
we have just a
Señora
relación.
couple of
Esther,
minutes left
hola,
for your
perdona,
presentation.
disculpa que
Is it
tengamos que
possible for you to wrap up
interrumpirla.
in 2
Sí,
minutes? Thank you.
ya, perfecto. Entonces,
Yes, okay.
hay una
So
mejora.
we have an
Antes, por
improvement,
ejemplo,
like
el
I've
tema de
been
los
mentioning,
indicadores
when
veía
it
que el
comes to
niño inicia la
indicators, and we're
suplementación, que
seeing
el
that
niño
children starts with the
inicia el
supplement
tratamiento, y
and
lo
the
mismo en las
treatment,
adolescentes y
and the
gestantes,
same
pero
thing
hoy en
happens
día se
with
está
the
apostando que el
teenagers.
niño culmine la
And
suplementación preventiva, que
sometimes
el niño
we
culmine el
need
tratamiento y que
to
logre
finish
recuperarse. Esto aplica para los
the
niños
treatment.
y
This
para las
applies for
gestantes. Tenemos
children
grandes
and
desafíos
for
porque a pesar que hay mejoras,
pregnant
sabemos que
women.
tenemos
We
una
know
brecha muy
that we
significativa y tenemos
have
que trabajar muy
a
fuerte
gap
ahí.
that we need to work.
Desafíos, definitivamente tenemos muchos. Uno de ellos es ampliar la cobertura y
Challenges,
mejorar
we
la
have
calidad de
many
la
in reference to
atención,
being able to
las
improve the
prestaciones
quality of
vinculadas a
attention
prevención,
and what is linked in reference to
diagnóstico, tratamiento y
prevention,
sobre todo el tema del
diagnosis, treatment, and
seguimiento
overall in
a los
reference to
niños, a los
follow-up.
adolescentes, a las
Follow-up
gestantes
to
para que puedan
children, to
culminar el tratamiento
adolescents,
y
to
puedan
pregnant women, for them to be
recuperarse.
able to finish treatment and for them to
Otro
be able to
desafío
recover.
clave para
The other
nosotros
key
tenemos
challenge
es la
for
brecha de
us is to be able
equipamientos
to
biomédicos, ya
reduce
sea equipos de
the
ferritina,
gap of biomedical
analizadores
equipment,
hematológicos para el
analyzers of
diagnóstico
hematology
etiológico
for
de
the
la anemia. Esto
diagnosis of
serían los
anemia,
establecimientos uno,
and
3
in
y uno,
reference
4.
to establishments 1,
Fortalecer
3,
las
and 1, 4,
competencias
to be
técnicas del
able to see
personal
the
de salud.
technical
Es
competences.
importante
And
que esto
this is
sea continuo en
important
el
for this to
tiempo.
be
Y
continuous throughout
también
time.
otro
And
aspecto es
also
disminuir
another
la brecha
aspect
de
is to reduce the
profesionales de
gap of
salud, ¿no?
professionals
Sobre
of
todo
health.
médicos,
Overall,
nutricionistas, enfermeras,
doctors,
etcétera, u otros que están
physicians,
vinculados al tema de anemia.
obstetricians, and
Es
those that are
importante
working
este
with
aspecto.
anemia.
El
It is
tema
important to consider
también
this
hay que
aspect.
trabajar en las
Something that we
estrategias
also need to work
comunicacionales,
on in
orientando al cambio
communicational
de comportamiento. Este es
strategies
un gran desafío
in reference to being
que
able to
tenemos
have
como
this
país.
large challenge that we have as a country, and also being able to see the practices of feeding in reference to the consumption of food to be able to mobilize the society in reference to anemia, to be able to create awareness. There is a challenge that is going to have an impact, which in human capital, which is the most valuable thing that a state can have in the communities and the authorities in pro of this fight. And also to be able to guarantee the access and availability of resources of animal origins is a challenge that we need to work on together with the Ministry of Agriculture, Ministry of Development and Social Inclusion, all of the sectors that are involved, local governments as well, to be able to reinforce the policy of fortification of food. We have two documents here. We need to work on them to be able to have this implemented correctly, and also in reference to universal fortification. Here we have the part of fortification and the children's feedings. We need to develop educational programs to be able to promote a healthy feeding. This is very important to be able to reinforce the articulation with the different sectors. We are currently working. I think this is one of the most important aspects with the different sectors. We've had many meetings. We need for this to be able to be concrete in actions. We need to be able to continue. And also in reference to a local level and regional level, we have one of the largest trends in reference to the governance, promoting the participation, active participation of regional governments and local governments in the planification, execution of the interventions as well. Apologies, I truly apologize. This is something that is very much interesting to all of us. But unfortunately, I have to interrupt you so we can continue and finish the event. Yes, this is all. We have largest challenge and also reference to interoperationality is also very important. Thank you very much. Thank you. Thank you very much. It's very much interesting for all of us. In the case of Peru, it's very much relevant. We, of course, appreciate the effort. Audrey, over to you.
Thank you so much, Vanessa. And in view of the time, we're going to forego the activity that we had planned. We have run a little late this morning, but if you look in the chat, you will see a link where we're asking you to identify some opportunities and challenges that you might have. So we'll continue that just through you clicking on the link and carrying out the activity. I'm going to hand over now to Leon Nedavine for a short Q&A session. We have been trying our best to answer some of your questions in the chat, so some of them are already answered. But Leo, maybe you can help us address a couple of them. Thank you.
Yes, thank you very much, Audrey. And just to repeat that, look at the chat. There's Leslie posted a link. We would like you to answer some questions because this will help us to target better our technical assistance that you might need in the future. So please, when you have a moment, it can be even after the webinar, if you could complete that. Yes, as Audrey said, many questions have been answered already, but I think I will just give the floor to Maria Nieves, to Lisa Rogers, to Leslie, and to the colleague from Peru. There was a question about Puno for the colleague of Peru. Just if you see any question or if you want that you would like to answer live or any comments, any final comments you would like to make. So I just start with Maria Nieves.
Yes, I will say for time's sake, I see and I really appreciate the big amount of questions, and we can maybe answer them later, but I think we are over time. Yes, inflammation is important. You need to be aware of what is the cause of your anemia and the causes of inflammation. There are questions about altitude and how you measure this, if you are GPS. So yeah, all these are interesting questions, but I don't think we have the time to answer them now. Maybe we could receive some of them and then we can answer.
Yes, I think so, and we have the context, so we can probably make sure that they are being answered. Yes.
I answered like 5 or something, but I think that
Yeah.
it's not only
Okay,
one to
and we can
address
disseminate it. Okay, thank you, Lisa.
Likewise, a lot of excellent questions. I really appreciate the questions coming through on, how do we look at lead and its relation to anemia? It's a really important environmental health aspect, as well as the different diagnostics for non-invasives. Those have been coming very frequently. The requests for how do we screen different population groups for anemia that is done in a more non-invasive way. And we hope to be able to get into some of that in the future, as well as, the calls for point of care tests for ferritin in lower resource settings. Those are all really important. And then just the last comment on WHO's recommendation for multiple micronutrient supplementation. We do hope that we will be able to take the evidence that has been generated since the last update in 2020 and see if that recommendation needs to be updated with this additional information. So we hope to have more updates for you within the next year or two. So thank you for all the questions and happy to continue answering them next days.
And just to complete, to put on top of that, that we are trying to get the cutoff and or the association of hemoglobin cutoffs to functional outcomes, resultados funcionales, but we are not yet. Yeah, we're not there yet. Yeah, that's the other. Yeah.
Okay, thank you. Then, Leslie, any final words?
Thank you, Leo. Solo un breve recordatorio
Just a
que
brief
cuando
reminder
hablamos
that
de
when
todas
we
las
talk about
deficiencias
all
de
of the
micronutrientes tenemos
deficiencies
que
of
tener como esta
micronutrients,
mirada
we need
hacia
to
los
have like this
sistemas
overview
alimentarios y hacia
towards
su
food
transformación
systems,
para
making the
lograr
transformation
pues
to be able to have a
digamos
well,
una
let's
prevención, un
say a
manejo y un control mucho
prevention,
más
a
sostenible y a
management or a
largo
control that
plazo.
is more
Eso es
sustainable
también
on
es
a long-term
importante y
basis.
no
That
es
is
un
why
tema
it is
ajeno
important and
a
it is
nuestros
not
ministerios de
something
salud y a
separate
nuestra
from our ministries
Secretaría
of
de
health and
Salud.
our
Entonces,
Secretariat of Health.
nada,
And
recalcar que
yeah, just
consideramos que
that I
es
wanted to
importante
highlight that it's
involucrarse en
also
estas áreas
important to
para
get involved
promover
in these areas to be
políticas
able to
públicas que
promote
sean o nos ayuden
political
de manera mucho
policies that
más
are public
sostenible y a
policies that are
largo
able to
plazo
help us
a
on a more
mejorar la
sustainable
alimentación y la
and
nutrición de
long-term
toda la
basis to be
población.
able to improve the nutrition of all of the
Gracias.
population. Thank you very much.
Okay, thank you.
Okay, yes, thank you.
Esther Molina, algunas palabras
Esther
finales,
Molina, any
una
final
pregunta
question,
de
any
Bruno, por favor.
closing words? There was a
Sí,
question from
muchísimas
Bruno, I
gracias a
think.
todos.
Yes, thank you very
Bueno, en
much to
realidad, en
everyone. Well, in
resumen, los
reality, in
lineamientos,
reference to the
ha
alignment,
habido una invitación a
there has been
todos
an
los gobiernos
invitation made
regionales
to
de
all of
varias
the
regiones
regional
que se han
governments, but there
sumado
are regions
y
that have
esto
also
sigue
added,
en continuo
and this
proceso, ¿no? O sea,
continues in a
Perú también puede
continuous
incorporarse,
process.
así
Peru
como
can
otras
also
regiones. Igual
have
hay
this done, such as other regions.
siempre está
There is
la
always
colaboración por parte del
the
Ministerio de Salud
collaboration on behalf of the
internacional.
Ministry of Health.
Bueno, agradecerles
And to
nuevamente
be able to thank
este
you once
espacio, esta
again for this
invitación y por
space, for
haber
this
compartido
invite,
con ustedes. Tenemos
and having been
muchísimos
able to
desafíos
share this
que
with you.
seguir
We have many
trabajando en
challenges that we
conjunto.
need to
Muchas
continue
gracias a
working
todos, muy
together. Thank you
amable.
very much. Very kind of you.
Bueno, muchas gracias. Entonces, resumiéndolo
Very
un
good. Thank you
poco,
very much. So,
en pocas
seeing
palabras,
this in a
nosotros
very
en
few
este
words,
webinar
we're
hemos
going to continue in this
visto
webinar. We've been
que
able to see
la región
that
está pues
the
avanzando
region
en la reducción
is
de
having
anemia,
progress
que
in
en
the
los
reduction of
últimos años
anemia,
ha
but in the
habido un
last years, there
estancamiento
has
en el
been
referente a
a
la anemia y por eso
stopping in
tenemos
reference
que
to anemia, and
intensificar
that is why we need
esfuerzos
to be able to
y hemos visto
intensify the
también
efforts,
que las
and also
soluciones se han
knowing that these
enfocado
solutions have
demasiado
been very much
únicamente ver
focused
el
on
hierro
only
como
seeing
problema
iron as an
y
issue
suplementación como
and the
la solución.
supplementation as the
Entonces tenemos
solution.
que
So
tener
we need to
mejores
be able
datos,
to have
hacer
better
mejores
data. We need to
análisis
have better
entendidos en
analysis
tiempo
made
corto
with the new
y
cutting
también
points,
implementando el
and
código de marco de acción
to
donde
being able to
estamos
take this new mark of action
sigamos abordando
in
todas las
reference to
causas
where
y
we are
sobre
seeing
todo
all
las
of the
causas
causes and
más
overall
al fondo del
the
problema
causes that
de
we're
la
able to see in the
malnutrición por
issue of malnutrition
micronutrientes
on
y
behalf of
de hecho tenemos que
micronutrients.
buscar
And therefore,
soluciones que
we need to look
abordan
for
la
solutions that
malnutrición
are
de
able
todas
to
las
see the
formas
malnutrition
a
in all of
través de
the
la
shapes
transformación de los
throughout the
sistemas
transformation
alimentarios
of
que
the
sean más
food
sostenibles,
systems that are more
que sean
sustainable throughout
enfocados en
times, that are
alimentos
mostly
naturales y
focused on
nutritivos que
natural
poseen
foods and
micronutrientes y
nutritional
evitando los
food,
alimentos
avoiding
ultraprocesados. Es
ultra-processed
importante
food. That is
trabajar
important to be able
más
to
en
work
conjunto con otras
together
agencias de las
with other
Naciones Unidas,
agencies
con
from the
otros
United
ministerios de
Nations,
salud.
with other
Y
ministries
Perú
of
es un
health. And
ejemplo
Peru is an
excelente
example an excellent example.
aplicando esta
Peru,
misma
applying this
filosofía,
same
ha logrado
philosophy,
disminuir
has been
mucho
able
el
to have
nivel
a
de nutrición
complete
crónica
reduction,
y creo que
a
ha
true
ayudado a
reduction
otros
in chronic
países.
malnutrition and also
Su
for other
plan, que también tiene
um,
el apoyo de
countries.
los
It has the
altos
support
niveles
of the highest levels
Estado.
of this
Creo que
state.
Perú
I think
va
that
a tener
Peru is going to
muchos
have
mejores avances en el
much more
próximo
progress
futuro.
in
Con,
the
con esto, pues les agradezco
future. With
mucho su
this, I would like to
atención y
thank all of you
paso
in reference to your
la
attention,
palabra
and we
a
give the
Vanessa
final
García
words to
Enlace, la
Vanessa,
jefe de la Unidad de
just
Desarrollo y Nutrición.
in the front part of
Gracias.
rescue nutrition. Thank you very
Muchísimas
much.
gracias, Leo.
Thank you
Thank
very
you
much,
all very
Leo.
much for joining us today. I think we've addressed some really exciting points about opportunities to move forward with this important agenda. I'd just like to close by thanking our colleagues at the WHO, Maria Nieves Garcia, Lisa Rogers, our colleagues in Peru for presenting, Esther Molina, all of you who are participating, and perhaps I don't know if my colleague from the Department of Nutrition at headquarters, Luz Maria Dorogil, is here and would like to say anything to close. There you are. Hello.
Here I am.
Just shows the interconnectivity between the two between the headquarters and the Pan American Health Organization. We're all working together for this. And of course, sorry, Leslie, Beja, and Leonard, there have been our colleagues here at PAHO who've been leading this wonderful work. So over to you, Luz.
Voy a hablar en español, es poco raro porque casi nunca lo hago,
I'll
pero
speak in Spanish. It's strange. I never do speak Spanish, but I think it's important to do so now. First of all, we would like to congratulate the regional office. It is encouraging to be able to see that there are more than 350 participants connected. This talks about the interest and our friends to being able to see the very intense work that has been done by the region and our friends to being able to have this in a relevant manner, not only by working in reference to the guidelines the central, the headquarters is able to develop, but it's also about being providing, recollecting data, information, and transmitting this directly onto the countries. It just helps them in the efforts to be able to have this monitorized. It's very much complete and it's complementary with what we need to do in the central office of Geneva. It is an opportunity. I know that this is one of the last DAs that Leo is following. It's the last one. It's the last one. Today is the last day that Leo is here. So he is working until the last minute. And I just wanted to connect and I wanted to tell you, Leo, that from here we've truly appreciated everything you've done for us in collaboration, not only in anemia, but in different areas. You have been a fantastic collaborator throughout these past years. And well, this new stage that you're beginning, we wish you the best success. And of course, we will be in contact. It's going to be difficult to continue working this without your energy and your commitment. So thank you very much and the best of lucks. Thank you very much to you and to WHO and PAHO for all of these years and also the ministries that are all present and all of my colleagues. Thank you very much. Thank you. Thank you very much.
Muchas gracias. Thank you very much.
Thank you very much.
Thank you very much, everyone. Thank you so much for giving the opportunity.
Thank you very much to the nutrition team again, and we hope to be able to see you soon to be able to continue with this very much important dialogue. Thank you.
Thank you, Leo.
Thank you.